Hello everyone, welcome to Heal&Care Wound Talk, your go-to source for expert insights in wound management. Today, we will uncover the essentials of wound management to improve healing outcomes, and we will be shedding light on a critical yet often misunderstood topic in healthcare, which is wound management, and the difference between wound management and wound care. So whether you're a healthcare professional, a patient, a caregiver, understanding this distinction can make all the difference in healing outcomes. So let's get started. So let's start with the definition of wound care versus wound management. So wound care refers to the local treatment of a wound, or it pertains to providing the basic first-line intervention to a wound, in which it includes cleaning the wound, dressing the wound, infection prevention, and monitoring. While wound management, this goes just beyond dressing changes, or it goes beyond the basic wound care. Wound management is broader, and this is a holistic approach. It is a comprehensive, long-term strategy that addresses the systemic factors affecting healing. For example, if the patient has comorbidities such as diabetes, if the patient has circulation issues or nutritional issues, those factors needs to be addressed in order for a wound to heal. It also involves utilization of advanced therapies and requires interdisciplinary collaboration to optimize healing. So there you have it. We have both defined wound care and wound management. To recap, wound management is a comprehensive approach that includes thorough assessment, development of an individualized treatment plan, addressing systemic factors that impact wound healing, utilizing advanced wound care therapies, employing a multidisciplinary approach, and encouraging patient involvement and lifestyle modification to optimize healing outcomes. Let's take a deeper dive into wound management. Wound management, again, is a comprehensive approach that involves assessment. Let's discuss about assessment of the wound itself and the factors that maybe affect its healing. So in assessing the wound, the first step is to evaluate the wound itself, what type of wound it is, its classification, and its healing status. Wounds are generally classified as either acute or chronic wound. Acute wounds usually heal within 2 to 4 weeks, while chronic wounds persist beyond 4 weeks and require more specialized care. We also need to determine the classification of the wound. Is it pressure injury, a diabetic foot ulcer, a venous leg ulcer, an arterial ulcer, or a surgical site infection, or a burn wound, or a trauma-related wound? Each type requires a unique approach to treatment. Additionally, a thorough wound assessment includes evaluating the tissue status, the drainage or the exudate of the wound, if there is odor, the moisture balance, and assessing the periwound skin condition. In identifying the tissue status, we have to identify if there's presence of necrotic tissues, granulation tissues, or epithelial tissues, as this signifies which phase of healing the wound is progressing to. Drainage or exudate level mild, moderate, or heavy should also be assessed, and its consistency and type, either it's serous or clear, drainage or exudate, purulent, meaning there's a presence of pus, or sanguineous, meaning the drainage is bloody. You have to also look if there is a presence of odor that may indicate infection. Moisture balance, you have to ensure that it's neither too dry nor too moist, in which too dry can impair healing and too moist can lead to maceration and infection. Also, checking the peri-wound skin condition or monitoring the patient's peri-wound skin is also important, as these can indicate infection. We have to check for signs of inflammation, edema, or compromised skin integrity. Now let's go to assessment of systemic factors. Wound healing isn't just about the wound itself, it's also about the patient's overall health. Now, in order for us to treat the patient as a whole, we need to assess the underlying medical conditions of the patient, the medications, and the circulation issues of the patient. Also, we have to, in assessing the medical condition, we have to check the type of diseases that the patient, chronic diseases the patient is having. For example, diabetes, chronic heart failure, if the patient has vascular issues, or patient has nutritional deficiencies that needs to be addressed, as these can all impact healing. Medication as well has impact in wound healing. For example, the patient is in a long-term corticosteroids, in which this is a medication that can impair wound healing. Circulation issues. For venous leg ulcers, compression therapy is the gold standard, but arterial insufficiency must be ruled out first using an ABI or Doppler ultrasound. If arterial disease is present, modified compression strategies should be used under specialized guidance. Patients with chronic heart failure should also be closely monitored, as compression therapy may increase fluid overload. So, in wound management, it's all about assessing the whole condition of the patient, not just the wound, in order to optimize wound healing. And in wound management, it's also recommended to use advanced therapies once standard treatments are no longer effective. What are the advanced wound care strategies that are proven effective? Negative pressure wound therapy, utilization of advanced wound care dressings, utilization of bioengineered skin substitute or skin grafts, stem cell therapy, mist therapy, or any other modalities that have been proven effective in wound management. Final thoughts: comprehensive wound management is more than just treating the wound. It's about treating the whole patient. As Gary Siebold says, treat the whole patient, not just the hole in the patient. So if you're a healthcare provider, I encourage you to look beyond the wound and address the factors that influence healing. If you're a patient or caregiver, knowing the right questions to ask can make a significant difference in recovery. This is April, your wound care specialist, and thank you for tuning in. Stay with me as we continue to explore wound management in future episodes. one topic at a time to raise awareness and educate healthcare professionals, caregivers, and patients. Again, thank you and see you in my next episode.